So, you have cancer. That's pretty terrible. You're also probably going to start a chemotherapy regimen soon. Well, let's talk about one of your options. Taxol is used for the treatment of many types of solid tumor cancers. Taxol, isolated from the bark of the Pacific yew tree, is one of a host of chemotherapeutic agents within the taxane family. This drug has also been marketed under the names Taxol and Abraxane.
Taxol is a potent anti-cancer drug within the class of chemotherapeutic drugs called taxane. This drug targets patients with leukemia, a cancer of the body's blood-forming tissues such as bone marrow and lymphatic system. Leukemia usually involves the white blood cells that are produced abnormally and don't function in a way that they should. It also targets patients with solid tumors, with 48% of the patients having metastatic breast cancer, 30% having ovarian cancer, and the remaining 32% split between brain and lung cancer.
Taxol kills cancerous cells by disrupting microtubule assembly in rapidly dividing cells. It binds to the beta-tubulin subunits of microtubules and hardens the polymers within them. They are then unable to engage in mitotic spindle assembly, chromosome segregation, and other functions associated with mitosis appropriately because they form additional hardened spindle poles. These defective spindle poles cause the chromosomes within a cell to be divided into multiple directions during anaphase, and 3 or more daughter cells are typically produced rather than the usual 2 daughter cells. Cytokinetic furrows do not form properly between these daughter cells unless they remain partially connected. The resulting mass of daughter cells are aneuploid, and many of these die due to the lack of chromosomes that are vital for normal cellular function.
Current research on this drug focuses on its off-label use as treatment for multiple sclerosis. When given in high dosage, Taxol appears to facilitate the remyelination of damaged neurons. However, a study in 2002 found no significant reduction in MS symptoms in patients treated with Taxol as compared to controls. The mechanism of action behind Taxol's potential for facilitating remyelination is poorly misunderstood. Current studies into this area hope to elucidate this mechanism of action. Researchers are also attempting to determine if weekly treatments of Taxol are more effective in treating end-stage breast cancer than the traditional treatment schedule, which consists of Taxol infusions once every 3 weeks. Preliminary findings support the weekly treatment of schedule as the most effective way to treat some types of stage 4 breast cancer.
Taxol targets rapidly dividing cells. These include cells of the integument, cells lining the digestive and urinary systems, and blood cells. When Taxol reaches your healthy cells, it keeps them from regenerating as they do on a regular basis. Since your healthy cells are less able to regenerate following normal wear and tear, you can expect to experience skin rash, itching, sweating, ulcers, sores or white spots on the mouth, cracked lips, pale skin, hair loss, redness of the face, neck, arms, and upper chest, difficulty with swallowing, and nausea or vomiting. The nausea and vomiting can make you very susceptible to dehydration. Symptoms of this include confusion, dizziness, faintness, or lightheadedness when getting up suddenly from a lying or sitting position. Since your red and white blood cells cannot efficiently multiply under Taxol treatment, you will likely experience immune responses such as a cough or hoarseness with fever or chills, tightness in the chest, wheezing, sore throat, and unusual tiredness or weakness. You may also expect black or tarry stools, blood in urine or stools, painful or difficult urination, and unusual bleeding or bruising accompanied by lower back pain. Over time, Taxol is known to accumulate in or around the dorsal root ganglia and brain, causing peripheral neuropathy. Peripheral neuropathy will manifest as a host of symptoms, including blurred vision, unsteadiness or awkwardness, numbness, burning or tingling in the hands or feet, and pain in the joint or muscles, especially in the arms and legs. Remember, though, not all individuals will experience all of these symptoms, and many treatment options exist for these symptoms.
Hey, so I'm filming this right after chemo, and this is probably one of my worst moments right after and I'm here to give you the exact feeling of what it's like. I feel like I have a horrible hangover. My stomach hurts and my head hurts, and I just feel exhausted, but I can't sleep. So I'm awake in bed in pain. I took nausea pills. They do help, and I get to take them once every 4 hours. Anyways, you gotta fight. Ugh, I'm playing. I'll be fine. Don't worry about me.
The effectiveness of Taxol varies greatly between populations. However, research suggests that Taxol, when used as first-line therapy to treat metastatic breast cancer or cancer that has spread to other parts of the body, overall response rates are in the range of 30 to 60%. This means that in 30 to 60% of patients with this type of advanced breast cancer who are treated with Taxol will experience a reduction in the size of their tumor.
Taxol is given intravenously. It is typically given via a port with a shunt that leads directly into the patient's heart, as Taxol can irritate and even damage small blood vessels, like those typically used in an IV. Taxol must also be given by a specially trained healthcare provider and is typically given in a hospital or cancer center. The number of Taxol treatments a patient must take depends heavily on the type of cancer they have, as well as the stage of that cancer. Some people may also be prescribed drugs to take in addition to Taxol that help to mitigate side effects caused by the chemotherapy. These include drugs to help with nausea, pain, depression, and to boost the immune system.
You should not be given this medication if you are allergic to Taxol or other medications containing an ingredient called Cremophor-L. This includes cyclosporin and tenapoised. To make sure you can safely take Taxol, tell your doctor if you have any of these conditions: HIV, AIDS, sarcoma, heart disease, anemia, high blood pressure, or liver disease. Do not take Taxol if you are pregnant or plan on becoming pregnant. It could harm the unborn baby. Use effective birth control and tell your doctor if you become pregnant during the treatment. It is not known whether Taxol passes to breast milk or could harm a nursing baby. You should not breastfeed while you are using Taxol.
In summary, Taxol is a moderately effective chemotherapeutic agent for treating many solid tumor cancers, such as breast and ovarian cancer. The drug disrupts mitosis and stabilizes microtubules within cells, inhibiting cancer cell proliferation. Side effects may be present across all anatomical systems and in organs whose cells divide rapidly. Taxol is known to accumulate, causing peripheral neuropathy, but this is common among the side effects of chemotherapy. Ask your doctor today if Taxol is right for you.